I was aware because I would get calls from the hospital, how many drug poisonings he was experiencing. And some weeks there was a couple.
We have now lost 10,160 Albertans to toxic drugs. To put this number in perspective, 3,861 more people have died in this crisis than have died from COVID-19 in Alberta.
The drug poisoning crisis is negatively impacting every single facet of not just our healthcare system, but our city and our society.
So when we say fentanyl, when we refer to street opioid supply, we're really referring to a cocktail of a number of different types of synthetic or man-made lab-produced opioids in a very unpredictable mixture. So we call it fentanyl, but it's really, dozens of different types of opioids combined into one product that people are using. So it went from being something very consistent and very predictable to something that's very inconsistent and incredibly unpredictable. So as a result of that, people don't know what response they're going to have when they're using some of that substance. And in a lot of cases, as the drugs become more potent and more volatile, the response that people are getting is not something they wanted. It's overdoses or poisonings, really, in this case, and often death. So the safer supply models that most of us are familiar with involve a patient, someone with an opioid use disorder, someone who's using opioids, presenting to their clinic, seeing their physician, their nurse practitioner, asking for support with what's going on, interested in reducing their risk of overdose or death, and being provided with a safe alternative to what's out on the streets. So often that's a prescribed opioid. Again, something that is going back to that predictable source of opioid where people know what they're getting and they know what response they can expect. And there's quite a few of those different formal models set up in certain parts of the country. Here in Alberta, we never had formal safe supply programs, but there were a number of people who were prescribing in this way to their patients who were at highest risk of overdose or injury from the toxic and unpredictable street opioid supply.
My name is Ophelia, and I am 23 years old. I love spending time with my cat, with my mom, with my boyfriend. And I am a substance user. For a while, I used fentanyl. I tried multiple different things to get sober. Like, for example, things like Suboxone and methadone, the frontline treatments that they give to people, but none of it worked. Then I remembered that when I first started using opiates, before I switched to fentanyl, I had been buying Dilaudid. Dilaudid is the brand name for hydromorphone. So I asked her for Dilaudid, and she gave me the prescription. And at the time when I first got this prescription, I wasn't sure if it would work. I wanted to try. I didn't want my mom to need to attend my funeral, and I knew that if I kept doing fentanyl, that was what was going to happen. I wanted to try getting better.
In October of 2022, through an amendment to our Mental Health Services Protection Regulation, the government introduced something called the Narcotic Transition Services Standard. We refer to it as NTS for short.
It was just announced one day on October 5th. All of a sudden we found out that's no longer in our hands. This is no longer a thing that is able to be offered to patients.
What NTS basically said was that prescribing short-acting opioids, which are typically what are used in safer supply programs, so things like hydromorphone, morphine, fentanyl, these types of medications, could no longer be prescribed for the treatment of opioid use disorder outside of very, very stringent restricted environments.
We had 5 months. If anyone was on prescribed safer supply, we had 5 months to take them off, just keep them on opiate agonist treatment, or they could transition to one of the few clinics in Alberta where somebody would watch them take their medication.
As it stands now, as far as we're aware, the consequences of not following this regulation is a $10,000 a day fine for prescribers, and similarly a $10,000 a day fine for pharmacists if they're dispensing these medications outside of the dedicated NTS clinic spaces.
I will sometimes compare safer supply to like a rescue inhaler, like asthma. We sort of tell people always keep like your blue puffer on you, because if you need it, you want to have it right then and there. And sometimes people can use it 3-4 times throughout the day. People can use prescribed safer supply when they start to feel unwell. They'll take some prescribed safer supply. They also will sometimes use it 3 or 4 times throughout the day as well, as they feel like they need it. That option is eliminated. So if you think about, again, we'll use the asthma analogy. If every time you start to feel short of breath or your chest starts to feel a bit tight, you then have to go to the clinic and someone needs to watch you take your inhaler. That is what has happened to safer supply in Alberta.
The move with the Narcotic Transition Services is pretty unprecedented, certainly in Alberta, but across the country, for a provincial government to come in and say, you are now no longer allowed to prescribe a certain type of medication. It's not about funding. It's not about certain criteria that you might have to consider when making a decision. Essentially, they came in with very little warning and said, even though you're physicians, you're nurse practitioners, you're experts in this field, and you know your patients, we don't really care about any of that. You're no longer allowed to prescribe this medication, period.
The first month of getting my prescription, I was kind of thinking that, maybe I'll lose it at some point. I had been on it for 2 years, and I had used that as a foundation to build a healthy life that I'm really, really happy with. And at this point, having it ripped away from me, that just feels terrifying and impossible.
She was prescribed medical grade opioids. She could pick it up from her local pharmacy, take them home every day and inject herself so that she was stable and able to live a life of a 21-year-old. The Alberta government came and said that it's not safe for you to go to the pharmacy yourself to get this medication. You have to travel between 90 minutes to 2 hours each day to downtown Calgary, and under the supervision of a medical staff, that is only when you can access this medication. But 2 of her 3 dosing times was when the clinic was closed. The idea of being in traffic for 3 to 4 hours a day on public transit didn't make it viable. So essentially, what the government was proposing would take her back to street source opioids and experience all the harms that she had escaped. So multiple overdoses, near-death experiences, sexual exploitation and violence.
I think Ophelia Black's case highlights an unspeakable cruelty on the part of the government and the healthcare system, that a policy could be made that would deny treatment to an individual in the manner and the way that they did. It's totally unfeasible for a situation.
I spoke to my doctor, and she suggested that she writes a letter to the government, to the people who are behind this decision, basically explaining that, I haven't had a single overdose on my meds ever, that I have multiple clean urine tests proving that all I've taken is my meds, that all of the physiological ways that it helps me, about all of the progress that I've made. She ended up writing a really, really long letter to the government explaining all of this, and they said no. I don't know if they ever even read it. But that was when I realized that there's nothing else that I can do. And that's when I contacted my lawyer and went through the legal route to try to keep my prescription.
I think the judge himself recognized that we're in a pretty dark time in Alberta, number of overdoses and deaths. And we have this young person who has made so much progress that has, defied the odds in many circumstances because she was able to access this specialized program. And shutting that down would mean near death for her. So I think the judge was very taken by that and decided to allow her to continue to access this treatment until we figure out if this is even lawful, if the Alberta government can even do this.
The judge's ruling on Ophelia's case, I think, was really impactful. First of all, it allows her to continue to access the medication that's worked really well for her for years now. So that's obviously the most important part, because she's still alive and healthy and thriving and doing well because she still has access. She's the one person in the province who still has access to safe supply. But part of the ruling also outlined the fact that these regulations certainly impact her, but the regulations are directly impacting her prescribers. We are the group that is regulated by these standards. And he outlined in his ruling that decisions around treatment, what medications to take, what medications to prescribe, is something that should be made between a patient and their prescriber. That is not something that should be interfered upon by the government.
The judge cannot comprehend or think of any other scenario where the government is telling a medical practitioner that, you cannot prescribe this medical treatment regime even though it's in the best interest of a patient. And it raises this kind of uncharted issue that courts have to grapple with, is to what extent can governments get in between a medical physician and the patient about providing them healthcare? And it's a really troubling precedent.
Whether I get to keep my prescription and keep doing what I'm doing, keep doing what works for me to stay safe and healthy, or whether I lose my prescription, potentially relapse onto fentanyl, end up dead, maybe. Either way, it won't affect them. And it just feels like if it won't affect them, why do they care so much about making sure that I don't have the medication that keeps me alive?
We grew up together, so
Yeah.
I was a kid when I had Brandon.
For me, it's, we talk about that radical acceptance and like my mom just like completely having to like change the way that she like approached our relationship. I love you. For like 15 years, my mom had this kind of like, we'd already talked about it, but just this preset, everything that she'd been taught in society about how our relationship was supposed to go, and she threw it all out the window, and she completely, like, overnight changed, like, our relationship and just, like, her, yeah. And it's just time for someone to, like, yeah, I don't know, it just means a lot, right?
I love you. I was constantly getting calls. I had also found him once on Outrage and reversed his poisoning. And being a member of Mom Stop the Harm, I know that that's the reality. My friends have buried their children, and it was just. I just knew that was my reality. People used to say, "Oh, you gotta have hope," but I didn't have hope anymore. So I was just doing this so I could spend time with him and make that connection in the community.
Hi, I'm Sarah Auger. I'm a citizen of Miksukri First Nation in Fort Chipewyan, Alberta. I was born and raised in Edmonton. I am an assistant professor at the University of Alberta in the Faculty of Education. I became what a friend of mine called an accidental advocate for harm reduction after my 31-year-old son, Lakota, died from fentanyl poisoning in December 2022. Lakota started drinking. His first drug of choice was alcohol, and he started drinking as a teenager. I know now that not everyone who uses drugs has an addiction, but my son absolutely had an addiction. And I knew he was using meth, heroin, cocaine. I wanted him to get off of it, off of all of it. It was a constant, I guess, belief that if you had a problem with substances, that you needed to get abstinent. Like, that was the only way. You had to be clean or sober. I pushed him constantly to become abstinent. I didn't understand at the time that the substance use was not the problem, that it was a symptom of the problem, and the problem was just pain and anguish and trauma. And I didn't understand at the time that he was doing what he needed to do to deal with that pain and trauma. If I had known that there were options, that there was such a thing as safer supply, which I didn't know before that existed outside of abstinence, I would have steered him in that direction instead.
Because of safer supply, my son's alive. That is the bottom line.
And then it got to the point where I'd actually told them, like, I don't really need it anymore. I just went to the methadone, right?
He is sitting here next to me. We do outreach together. We teach naloxone together. We have family dinners together. He has relationship with his brothers and his stepdad, and I don't believe it would have happened without that opportunity he was given. And I will forever be grateful. That doctor, I still tell her every time I see her that she's my angel.
Since the implementation of NTS, we have seen consistent increases in overdose deaths or poisoning deaths, which, again, is not at all surprising, I think, to a lot of us who have been working in the province and seeing the direction that they're taking with the approach to addictions and substance use disorders, which is not to say that supporting recovery-focused options is wrong. That's what a lot of people want, and it does benefit a lot of folks, but we need the other things as well.
So we need both. It's not either or. Anyone who's giving you an either or option is being disingenuous with you. And I would be very suspicious of anyone who's offering you an either or option to anything. Anyone who's only offering you safe supply, you should also be really suspicious of that. But anyone who's an advocate of safer supply, I've never seen them say it's either this or nothing else. I can't think of any time that I've actually ever seen anyone say that. It's always offered in the range of options.
Even if the stories do not move your heart, the finances should move your head. We have a fire department right now that is not functioning to put out fires. They are functioning to deal with health issues, many of which are negative trickle down from the drug poisoning crisis. We can't get an ambulance in many parts of our city because the ambulances are tied up dealing with overdoses. We can't enjoy our rec centers, our libraries, our parks, our other spaces without seeing the human suffering around us.
I think if people would just put down the judgments, that judgmental attitude, and think they know what's best for other people, and leave it to the professionals and in science and facts and evidence, and not just a moral choice. Yeah, a moral crusade. That's all this is, right? It's not.
This is a decision that should be between a doctor or a healthcare professional and their patient. The government should not be involved in that at all. This is a healthcare decision.
I know that what I'm doing is the right way to handle this. I know that what I'm doing is important. So, as difficult and stressful as it is, all I can do is just keep going.